about our respiratory system, isn't it? So continuation from our class, the next diagnostic procedure is thoracentesis. The diagnostic procedure ante like a blood test, urine test, it's a diagnostic procedure. So what is thoracentesis? Thoracic cavity ante thoracic cavity lo emem unnai? Lung, isn't it? Main organs are lung. Is it okay, children, in English? Is it okay in English? Okay. So, thoracentesis is a procedure. So, from the removal of some fluid from the thoracic cavity with the pleural spaces. Stop, please. It's making very disturbance to me. See, thoracentesis means it's a procedure, the removal of a fluid, some amount of fluid from the lungs and the pleural cavity. Actually, when it happens due to pneumonia, pleurisy, there will be so much of collection of fluid in the lungs. So what happens due to this fluid in the lungs? It causes more pressure on the heart, and also for patient also it's very difficult to take breath, isn't it? So for diagnostic purpose, we are going to remove fluid from the thoracic cavity or from the pleural cavity is called thoracentesis. So thoracentesis is the diagnostic procedure. So this procedure will be done under local anesthesia. Local anesthesia means, what is local anesthesia? It's a administration of some local anesthetic agent like xylacin, 2% xylacin. 4% will be used for local application of drops. For example, in a cataract surgery, they will use 4% of xylacin. In case of this local anesthesia, we will use 2% of xylacin. So 2% of xylacin will be given under local anesthesia, and this fluid will be removed for the purpose of diagnostic procedure. Okay, that is called thoracentesis. What is biopsy? See, if it is biopsy, if it is a lung biopsy means a small piece is removed from the lungs. If it is a biopsy from any other organ, there a small piece is అంటే ఎక్కడ biopsy కావాలో అక్కడ ఆర్గాన్ చిన్న పీస్ తీసి it may be removed during surgery. ఆపరేషన్ చేసేటప్పుడైనా ఆ పీస్ తీయచ్చు. అదర్వైజ్ ఫర్ ఎగ్జాంపుల్ mastectomy, రిమూవల్ ఆఫ్ బ్రెస్ట్ చేస్తున్నారు అనుకోండి, నో నీడ్ టు డూ టోటల్ mastectomy చేసినప్పుడు కూడా పంపించవచ్చు. ఆర్ ఇన్ కేస్ ఆఫ్ నీడిల్ బయాప్సీ అంటే నీడిల్తో కనుక ఆ ఏరియాలో డ్రా చేసి ఫ్లూయిడ్ కానీ అది పంపించవచ్చు. దాన్ని బయాప్సీ అంటారు. ఏ ఆర్గాన్ నుంచి కనుక చిన్న పీస్ ముక్కని తీసి టెస్ట్ పంపిస్తారో దాన్ని బయాప్సీ అంటారు. సో ఇవన్నీ డయాగ్నోస్టిక్ ప్రొసీజర్స్. ఓకే, సో నెక్స్ట్ వాట్ ఈస్ ట్రెకియోస్టమీ. ట్రెకియోస్టమీ అంటే ఏంటి? సడన్లీ దెర్ విల్ బి అబ్స్ట్రక్షన్ ఇన్ ద ఎయిర్వే ఆర్ విండ్ పైప్ అంటే గాలి గొట్టం అనమాట. గాలి గొట్టం అంటే what it is? Where the air enters into the pipe, that is called windpipe. So suddenly if there is an obstruction in the airway, so which causes the patient, sometimes the patient may collapse. So when it happens, sometimes obstruction from the foreign bodies. Foreign bodies ante enti? See, some people while eating also they may have this obstruction. Sometimes any trauma to the patient. So patient may go into the unconscious. So that time also they need a tracheostomy. Tracheostomy is nothing but just opening or making a hole into the where between the third and fourth rings of cartilage in the neck. So in the neck region there will be a making emergency hole in diphtheria also, some patients will have a difficulty in breathing. In that time also, they does this tracheostomy. And also due to any chest injuries. Chest injuries also makes the patient difficult to take the breath. In that reason also, they will do the tracheostomy. So tracheostomy you might be seen in the ward. So how you are going to suction? So for everyone, while doing the suction, they should not increase more than 10 seconds. So suction to be done only 10 seconds. And while doing the suction also, the catheter should be 4 to 8 inches only you have to insert. So before doing the suction, the end of the tube has to be cleaned with the sterile water. So there should be some lubrication to the tube. Then also, while doing the suction, always follow the strict aseptic principle. Strict aseptic principle means strictly you have to wash your hands, wear the gloves, okay? So for if the patient is having tracheostomy, always make the patient comfortable position, like Paulus position. Then while doing this, after doing the suction, we have to give a frequent mouth washes to prevent the odor. Then encourage the patient deep breathing and coughing exercises. Okay. So after you doing the suction also, the tube has to be rinsed. Rinse ante the mucus anta lopala undipotadu kabatti after that you have to clean with the sterile water and keep it dry. So tracheostomy, paracentesis are small procedures you may get in the exam in a short questions. Okay. The next is condition we have studied pneumonia, tuberculosis and other conditions. The next condition is bronchial asthma. Asthma means ayasam, nammu. You might be seen so many patients with asthma. So what is asthma? Why it causes? Asthma means in asthma causes the air passage affection. So morely the air passage will be affected more. Sometimes it will become narrow. So nowadays what we have seen in the corona patient, so many patients are dying with this condition only due to narrowing of the air passages. The patient not able to take breath and they are dying. So what is asthma? Asthma is a condition that affects the air passage of the lungs. Air passages of the lungs.
Hello.
So, hello. Usually, there are so many reasons for asthma. If you observe, the mainly reason is for asthma, allergens. Allergens like please, I'm getting so much of disturbance. Hello, please, I'm getting so much of disturbance, girls. So bronchial asthma is the condition where the bronchial or a passage of the lungs will be affected and causes difficulty in breathing of the patient. The main reason, what happens due to this asthma, the air pipe will be narrow and causes the difficulty in breathing. So the main reasons for this asthma is some allergens. Allergens ante edanna kavu. So many people with the small dust also they will have a sneeze and cough, isn't it? The same way for this asthma there are number of causes like house dust, feathers, food preservatives, pollens, then pet dander. Okay. Then some cigarette smoke also some people will have this asthma. That means allergy. Then allergy to weather changes. If the suddenly weather changes also, the people may have this asthmatic attack. Then some irritant, like some sprays. Generally, the people use some sprays also for this. Sprays means perfume. Then deodorant, household cleaning products, like phenyl also. Some people will have this asthma. So the main causes for this asthma is allergens to anything: pollen, animal dander, cockroaches, mites. Okay. Then sometimes some people will have with stress also. They will have this asthmatic attack. Okay. So if the patient is having asthma, we are going to find out the patient is very difficult in taking the breathing, isn't it? Then the cough which contains mucus always. Then sometimes it is the asthma people will have a more attacks in the night. So this asthma or cough will be more worse in the night. While coughing and sneezing also, these people will have a wheezing sound. Wheezing means just like whistling while breathing. If you observe the asthma patients, then the patients complains the tightness of the chest. Then the person not able to take breath easily, and there are so much of mucus production while coughing. So what is the diagnostic procedure for asthma? So we have to check the pulse, percentage of the pulse with pulse oximeter, then a chest X-ray, laboratory just includes blood gas analysis, and we have to send for sputum culture also, so to identify the organism. So the main general nursing management includes, first we have to depend upon the patient condition, we have to provide the nursing care to the patient. First we need to provide some oxygen in case of emergency, then keep the patient in a coolest position always. Okay, then explain the patient to. So whenever there is a cough and mucus with expectorant, so we have to instruct the patient to take the more oral fluids, at least 8 to 10 glasses to liquefy the mucus. Then we have to advise the physiotherapy exercises. Then we have to encourage the patient to change the position. Okay. Then we have to administer. So if the patient is have a severe attack, we have to administer some bronchodilators. Okay. Then regularly we have to monitor the vital signs. Okay. Then we have to avoid to expose for some allergens. So we have to instruct to wear a mask. If the patient is has so much of problems with allergens, we have to encourage the patient to wear a mask. Then explain to avoid with the allergens which causes the asthma attack to the patient. So these are the things you will explain to the patient. Is it clear? Yes. So, till here you have completed respiratory system. That means you have completed 8 units, including important topics. The next one is nursing management of patient with gastrointestinal disorders. Okay. So mainly the gastrointestinal disorders will start with the recurrent questions we are expecting in the examination is constipation mainly. Okay. Then gastroenteritis and diarrhea. So you might be studied about constipation. Constipation, what is constipation? So constipation means not able to pass regularly motion, isn't it? So how we are going to define constipation is a condition in which there is a difficulty in emptying the bowels, usually associated with the heart and feces, isn't it? As we experience sometimes. Yes or no?
Yes,
So
ma'am.
what is constipation? Constipation is a condition in which there is difficulty in emptying the bowels, usually associated with heart and feces. So the main causes is constipation. Once if you do not pass motion for 2 days or 3 days, you will have so much of problems, isn't it? You are not able to eat, you will have a vomiting sensation. Sometimes you will have an abdominal discomfort, isn't it? You will have so many problems. So for this constipation, there are few reasons are there, like diet, low fiber diet. So always you should take the high fiber diet. Then inadequate intake of the fluids also one of the cause for this constipation. So always there is a low fiber diet and inadequate fluid intake. Some drugs, antidepressants, antihistamines also sometimes causes the constipation. So due to lack of exercises, then any functional disorders as cancer of the colon, spinal cord diseases like Parkinson's disease also causes the constipation. So what clinical features you will expect with this constipation? The main clinical features are abdominal discomfort, as you know, anorexia. Anorexia means not willing to eat, lack of appetite. Then straining to pass stool. So with this straining to pass stool also causes the hemorrhoids. Hemorrhoids అంటే అష్టముడలు అంటారు కదా, piles like. So sometimes if you strain to pass the stool also causes hemorrhoids and piles. So clinical manifestations which include abdominal discomfort, anorexia, abdominal pain, nausea. These are the main reasons for this symptoms for this constipation. So we are going to find out, sometimes it will be very severe in some cases. So that time we need to do the X-ray for this patient and we have to provide some treatment, like advising the patient to take high fiber diet like fruits, vegetables. Okay. Then explain to her to take the more oral fluids, at least 8 to 10 glasses. So if needed, you have to give some enema, soap and water enema to be given if the patient is having very difficult, or sometimes some patient will not be able to take breath also due to this pressure on the abdomen. So it causes very disturbance to the patient. So sometimes we need to give a enema also. Okay, these are the reasons. So diarrhea, I'm not explaining. Gastroenteritis is a big condition. So what is gastroenteritis? Gastroenteritis is the inflammation of the GI tract, gastrointestinal tract, which involves both stomach and small intestine, is called gastroenteritis. So what is gastroenteritis? It's the inflammation of the what is that noise? Avoid it, amma. నాకు ఎంత డిస్టర్బెన్స్ ఉంటుంది. ఏం నడుస్తుంది? Today is the last class I want to. So gastroenteritis is the inflammation of the GI tract which involves stomach, small intestine. Okay. So in this what happens? Actually gastroenteritis which involves the diarrhea and Also sometimes vomiting also. Okay. So what are the main reasons for this gastroenteritis? There are so many viruses are very causative organisms to cause this gastroenteritis. First of all, there are viruses which are adenovirus, astrovirus, then bacteria, staphylococcus bacteria, then salmonella typhi, salmonella bacteria, then some parasites also responsible for this gastroenteritis. So as if you observe how the clinical features will be for gastroenteritis, suddenly there will be nausea. Sometime before having a diarrhea, people will have a nausea, vomiting, then abdominal discomfort, cramps, and diarrhea. Then slowly it will be increased. The patient will have so many number of motions. Then as well as the patient will have a fever. Then sometimes it may be blood in the vomit and stool also. Then the patient will have a loss of appetite. Sometimes the patient may dehydrated with this gastroenteritis. Okay. So what is the nursing responsibility for this gastroenteritis? So there are so much of care to give a patient. First thing, we should explain the patient to avoid. See, whenever there is not even gastroenteritis, there is a diarrhea, you should not take any fruit juices. So explain the patient not to take any fruit juices during this time, and explain the patient not to take any cool drinks like sodas and cola also they should avoid. Okay. Explain the patient to take the ORS fluids as we know. Then explain the patient to take. The patient may not be willing to take the fluids, so we should advise to take a small amount of fluids. Frequent interval we should encourage. Okay. So we should strictly instruct the hand washing. So these are the main reason to get a gastroenteritis. So we should instruct the patient to wash properly their hands before and after eating and after defecation. They should wash their hands. Then if the patient is having gastroenteritis, the other people need to be maintain some little isolation. So the things which are used by the patient, those things has to be not be used by other people. Then, so whatever the food is taking, it should be boiled well before eating. Then maintain the cleanliness of food. Always avoid to take the food which is not covered. Some people will be eating outside. So what happens? There won't be any cover on the foods. So that should be avoid to taking. So then we should explain the patient to keep a sanitary, clean and dry. Then we should explain also proper sanitary disposal of the feces. These are the main things for gastroenteritis. So there will be similar nursing care you can write with gastroenteritis and diarrhea. So, starting in the gastrointestinal system, next thing is, see, as I said, thoracentesis is a removal of fluid from the paracentesis is a removal of fluid from the peritoneal cavity in case of ascites. Ascites means there is a collection of fluid in the peritoneal cavity is called ascites. Ascites అంటే కడుపులో ఇట్లా ఉబ్బెత్తుగా ఉండే వాటర్ ఉంటుంది. So that is called ascites. Ascites is a collection of fluid in the పెరిటోనియల్ క్యావిటీ. ఈ అసైటిస్, ఈ ఫ్లూయిడ్ ని తీయడాన్ని paracentesis అంటారు. You should understand thoracentesis is a removal of fluid from the thoracic cavity. Paracentesis is a removal of fluid from the peritoneal cavity. That is called paracentesis. Okay. Next thing, parotitis. Parotitis is a inflammation of the parotid gland.
Peritoneal cavity.
Parotid, P-A-R-O-T-I-D, parotid glands. Parotitis means inflammation of the parotid glands is called. So actually these are salivary, lalajala granthulu. These are salivary glands. So what are the main reasons for this parotitis are inflammation of the salivary glands are. So some people, the patient will be having prolonged nasogastric intubation. Some unconscious patients or semi-conscious patient will be having this nasogastric tube. So if they have a prolonged, they will have this lack of oral fluid intake also causes this salivary glands infection. Then due to improper oral hygiene causes the accumulation of the bacteria which causes the parotitis. Then poor oral hygiene. Then the people who are affecting the parotitis, the people is not immunized with MMR. MMR, what is MMR? MMR and vaccination, mumps, measles and rubella. So the people who didn't have this immunization also, lot of disturbance causes this salivary gland infection or parotitis. If the patient has this infection, salivary gland infection or parotitis, clinically the people will have a pain, dry mouth, then fever, sore throat. When there is an infection, always the patient will have a fever, sore throat and swelling. So for this patient, we need to do, so we have to administer some painkillers or tranquilizers. Then we should encourage a good oral hygiene. Okay. We should explain the patient to have a, or if needed, the patient able to take, we should encourage to have a oral fluids. Then we have to, for unconscious patient, the patient may not be express feeling. So always we should inspect the mouth daily for any redness in the mouth, so that we will have an idea whether a patient is having an infection or not. Then while doing this also, we have to, while doing giving a mouth care, we need to give a brushing to the patient. Then ask the patient to rinse the mouth every twice a day. Or if the patient not able to do, we should do the rinsing the mouth, or we have to provide some mouth care. The next one is glossitis. See, these are the small topics you will get in the short questions. Glossitis is a inflammation of the tongue or infection or inflammation of the tongue. Glossitis means inflammation of the tongue. So what happens due to this inflammation? The tongue will have a swelling, red. Sometimes the patient not able to eat, isn't it? So whatever you eat, they will have a pain in the mouth. For this glossitis also, we need to encourage for good oral hygiene and apply some lubricants. Okay. So explain the patient to have a small, not eating not spicy food. That is called glossitis. The next one is gingivitis. Gingivitis is very important. We are regularly having in exam. Gingivitis is an inflammation of the gums. Gums అంటే పుళ్ళు. Gingivitis is glossitis అంటే tongue. Gingivitis means gums. Inflammation of the gums is called gingivitis. So sometimes this చాలా మందికి of that tooth. అంటే వంకర టింకర పండ్లు ఉంటే కూడా బ్రషింగ్ అన్ని చోట్ల చేరక సమ్టైమ్స్ బ్యాక్టీరియా గ్రోత్ వచ్చి కూడా ఈ గింగివైటిస్ గమ్స్ ఇన్ఫెక్షన్ రావచ్చు. దెన్ మిస్సింగ్ ఆర్ irregular teeth. So these are the reasons for this causes. Neglected oral hygiene, malocclusion, missing or irregular teeth are the main causes for gingivitis. So ఈ gingivitis వల్ల ఏమవుతుంది? There will be a pain, swollen gums. చిగుళ్ళన్నీ వాసిపోయి మీ ఊర్లో ఇప్పుడు కూస్తున్నాయా కోళ్ళు? So in gingivitis చిగుళ్ళ వాపులో ఏమవుతుంది? దెర్ విల్ బి పెయిన్ఫుల్ ఇన్ఫ్లేమ్డ్ swollen అంటే చిగుళ్ళని వాచిపోయి ఉంటాయి. దెన్ సమ్ టైమ్స్ చిగుళ్ళ నుంచి యూ మే గెట్ ద pus. There will be a pus formation also, and due to this lot of infection sometimes there will be a abscess with the abscess అంటే pus నిండిపోవడం, and it will which causes the looseness of teeth and loss of teeth. ఈ పస్తో ఏమవుతుందంటే ఇన్ఫెక్షన్ స్ప్రెడ్ అయిపోయి ఈ టీత్ అనేది లూజ్ అయిపోయి పడిపోవడం జరుగుతుంది. సో డయాగ్నోస్టికల్లీ ఇప్పుడు దీన్ని ఎట్లా ఐడెంటిఫై చేయడం? డెంటల్ ఎగ్జామినేషన్ చేసినప్పుడు సో వీ కెన్ అబ్జర్వ్ ద స్వెల్లింగ్ ఆఫ్ ద గమ్స్ and loss in the tooth, redness and pus. So we have to do the X-ray. Okay. So nursing management, we should encourage the oral hygiene, including brushing the teeth twice a day, then rinsing the mouth regularly. Then if the patient is have a habit of smoking, explain to quit the smoking. Then administration of antibiotics. Okay. Then explain to avoid using spicy foods. So these are the things you can use a gingivitis. Next condition, ulcers, gastric and duodenal ulcers. అల్సర్స్ అంటే పుండు అనమాట, చిన్న పూతలాగా. ఇప్పుడు నోట్లో చిగుళ్ళలో కూడా పెదవి దగ్గర చిన్న పూతలాగా పుండు ఉంటుంది కదా, సేమ్ వే స్టమక్ ఆర్ డియోడినంలో ఈ పూత ఆర్ పుండు లాంటివి రావడాన్ని దాన్ని అల్సర్ అంటారు. సో యూఆర్ గోయింగ్ టు డిఫైన్ పెప్టిక్ అల్సర్ డిజీజ్. సో వాట్ ఆర్ ద అల్సర్? Duodenal ulcer, gastric ulcer. Okay. What is peptic ulcer? Peptic ulcer refers to the ulceration of the mucosa of the lower esophagus of the stomach. So these ulcers may be in the esophagus or in the stomach or in the duodenum. Okay. Ulcers refers to the ulceration of the mucosa. Ante pundu lantivi mucosa lo. It may be seen in the esophagus, stomach or duodenum. These are called the ulcers. Some main reasons for this. See who is coming now at the end of the class. So ulcers are mainly caused by some irritation. ఒక mucosa మీద ఎందుకు ఇరిటేషన్ అవుతుంది? Gastric ulcers and sometimes stress ulcers. So what are the main reasons for this ulcers are? Source of irritation. Sometimes there will be a breakdown, tissue breakdown. Due to some reasons or due to some disease condition also, which causes the tissue breakdown. So with the tissue breakdown, the people may have this ulcers. Some hormonal disturbance also causes the ulcers. Then some prolonged using of corticosteroids, overproduction of HCl, then eating the spicy foods. The person who is having cigarette smoking, stress means ఎక్కువ టెన్షన్ అది ఉంటే కూడా మీరు గమనించి ఉంటే కనుక కడుపులో అంతా వేడివేడిగా జ్యూస్ వచ్చినట్టు అవుతుంది. ఇఫ్ యూ ఎక్స్పీరియన్స్. సో స్ట్రెస్ ఆల్సో main reason is causing the ulcers. So what are the clinical features you can expect from the patient? The patient will be having burning pain before eating and sometimes after eating also. Okay. Some people will have a belching, painful ravanam. Okay. Not some people will have a anorexia, not able to eat with this ulceration. So with anorexia, automatically will go the weight and weight loss. Then some people will have a hematology, vomiting with the, so if it is ulcer or bleeding causes the hematology, blood vomiting. Some people will have a hemorrhage. So these are the main signs and symptoms with the ulcer. So what are the diagnostic procedures we have to do? First thing we have to do the radiography examination. The barium beam. So with barium beam means blood studies. In the gastrointestinal system, there is a test called barium meal. Barium meals, there is a substance which is given to the patient orally to drink. Then, like how we are taking the angiogram or angiography, the same thing we have to observe in the patient how this barium is going into the stomach. So where is the block is having. So this barium will be given orally. Barium enema is given through enema. That is to identify with the lower intestine. Okay. So for this one, bronchoscopy means visualization of the bronchus. It's called bronchoscopy. Endoscopy means visualization of the stomach, duodenum. Okay, these are the parts which visualize the endoscopy. These bronchoscopy and endoscopy will be putting through oral cavity. Okay, so fluoroscopy will be, or barium enema will be through rectum. We should understand the difference. Okay, so for this ulcers, we should encourage the patient to avoid spicy food, explain the patient to avoid stress, and explain the patient to take the small amount of frequent meals. Then explain to avoid taking the cool drinks which causes belching. Then explain to avoid excessive taking of tea or coffee, so which causes the irritation of the gastric mucosa. Okay. So if the patient have not relieved with the treatment, they have to go for a under surgery, that is called gastrojejunectomy, gastrectomy. These are the two surgeries they are going to perform. Okay, for every case, depending upon the patient surgery, you need to write the pre-operative care and post-operative care. Definitely there is a question. See, for example, the patient is having tonsillectomy. Tonsillectomy is removal of the tonsils, isn't it? So for that, what pre-operative care? Yes, routine pre-operative care you will be writing. Then we have to, what preparation you have to do? It doesn't need a preparation for tonsillitis, isn't it? So in case of gastrectomy, the patient is at gastrectomy. So you need to do a skin preparation on the stomach. Skin preparation ante shaving the hair on that line and dressing the patient with the antibiotic lotion. Okay. If you are doing some what else? Mastectomy. Mastectomy means removal of the breast. There you have to do the skin preparation. Depending upon the organ where they are going to remove, there we have to do the skin preparation. That is a difference. So if the surgery is performed under general anesthesia means we should give it. Now we are not giving enema. Before we used to give enema. In some hospitals, they are accusing some alkaloids are like that tablet they'll give to empty the stomach. Okay. ముందంతా ఎనిమో ఇచ్చేవారు ప్రతి సర్జరీకి, కొద్ది హాస్పిటల్స్ మాత్రమే ఇప్పుడు ప్రిఫర్ చేస్తున్నాయి ఎనిమో. అదర్వైజ్ alkaloids ఇచ్చేసి స్టమక్ ని ఎంటీ చేస్తున్నారు. ఓకే. డిపెండింగ్ అపాన్ ద surgery, we need to the preparation. Okay. So what is appendicitis? Appendicitis is a inflammation of the appendix. It's called appendicitis. There are main reasons for appendicitis. You must be experienced so many people. Actually, what happens here? The appendix is chinna part, isn't it? That will swell. Swelling వచ్చేసి infect అయిపోతుంది అన్నమాట. So once if it is in acute stage, it will be treated with antibiotics and the patient will be recovered. Sometimes what happens if it is severe cases, this appendix may burst. If it is burst means the patient may die. So if the patient is having a minor symptoms, if the patient is treated with antibiotics, it is okay. Otherwise the patient has to go under surgery, that is called appendectomy. Okay. So routinely you have to write the for appendicitis is also very important. You have to write the pre and post operative care. Okay. So this one remaining a 10th unit, I am going to give an assignment. 10th and 11th. Because I am having a lot of disturbance with my neck also. Okay, girls? Okay. So remaining 11, 12 and 13 units will be taken by Dharani madam. Okay, class? Okay. I'm not in a hurry to give an assignment. Slowly I'll give an assignment. Actually, we need to write a drug book in MS1. Okay? Compulsory, we have to write the drug book in an alphabetical order. That I'll tell you. Before only I must be told, isn't it? The beginning of our class only I might have told. Then drug book you need to complete compulsory. Then you have to write 2 seminars. 2 topics you have to write. After completion of our assignments, I'll give the topic. Each one has to write 2 topics as per your attendance. Okay. As per your rule number to write. Then you have to write the 2 nurses notes, 2 cardex forms, and 2 health tasks you have to submit for assignment. This will be given in the through WhatsApp. Okay. Then 1 unit I left it. Hello, are you able to follow?
Yes, we understand.
Okay. The 1 unit I am going to give an assignment. The remaining 3 topics will be taught by Dharani madam. Okay.
Okay.
Thank you. Thank you so much.
Thank you, ma'am.
Thank you, ma'am.